patients often ask about what the downtime is after this surgery. And now, although it is major surgery, patients are walking the same day, they're working and navigating stairs the same day, and they go home the same day. Now, are they running around like they were immediately before surgery? Most likely not. But typically I say, the first 2 weeks are rough, and then about the 4 to 6 weeks, patients are doing better. In terms of another question I get asked often is about driving. When can I return to drive? Well, typically for right-sided, it's about 3 weeks. For the left side, it's about 2 weeks. But really, it's a very personal decision. As long as your pain is well controlled, you're not on narcotic medications, your swelling is controlled, and you're functioning, well, and you feel comfortable behind the wheel, then I'm okay for you to drive. Another question patients ask is about hip precautions and limitations after surgery. And I'm of the mindset that you're undergoing this surgery to get back on your feet, to be doing the things that you love. And so I do not have formal hip precautions if I do the direct anterior approach, which is my main way of performing a hip replacement. And so all the activities that you love doing, whether that's playing basketball or golfing or whatever sport you're into, or just even running, right? I don't have precautions. Now, we do have a discussion about what level of activity you want to get to after surgery. There are some things to consider beforehand, but for the large part, I don't have overt hip precautions. Now, with a posterior approach, which some patients would benefit from a posterior approach for various reasons, in that case, I do something called posterior hip precautions, and that is because I do have to cut a muscle to get into the hip, but I repair that muscle afterwards. But again, for the large part, I do the direct anterior approach and no formal restrictions, and try to get the patients doing the things they love right away.